I found a quote that I'm sure you've all heard that's attributed to Dr. Theodore Woodward of the University of Maryland, where he said, when you hear hoofbeats, don't expect to see a zebra. And I believe the point he was making is when you're diagnosing a patient, look for the obvious. But obviously, when we're talking about rare diseases, that's not the case. In fact, it's the opposite. So Durhane, maybe I can come to you and just ask, when it comes to diagnosing rare diseases, currently, how long does it take to receive a diagnosis?
Obviously, the time to a diagnosis really depends on where you are, right? And obviously depends on the type of disease that you've got. So we're doing much better job in terms of diagnosing what we might call common rare diseases. These are the rare diseases which do have a very clear, not only just a definition, but they can be much more easily diagnosed. They can either be diagnosed by test, diagnosed by symptoms, but we still say somewhere around, I mean, we did research just recently in Canada. Again, it takes 5 to 7 years for somebody, when we ask people, how long did it take you to get a diagnosis? And that's kind of what the international experience is. The sad part about it is that most of these families also say we get 1 to 14 misdiagnoses before we get the right diagnosis.
What concerns us the most is for those who actually not being detected, not being diagnosed, who can never find a diagnosis in their entire life. Actually, we cannot survey them. They are not defined as rare disease patients in any way. They are not included in any of the database. They are not included in any surveys, in any research database. So where are they? Who they are? These are the questions that we cannot have answers. And is there any other different ways for us to find them? Like to discover the zebra among a group of horses. But if we do not even have a definition on zebra, then how can we find it? So that's the thing, the question that concerns me or the other patients' organizations most. Yeah.
You know, the training for primary care providers is very key, again, just because many babies or patients that, for example, you are treating for an infection, you give all the standard therapy, but the baby doesn't get better. It's maybe a metabolic disorder. But again, the challenges of how expensive is the treatment, or how if you know, the efficacy of the treatment.
We're in a situation here in South Africa, we don't have access to newborn screening. It is not it's available for a fragmented few in of the population that can access private healthcare, which is only about 16% of the population. And then even things like a non-invasive prenatal testing, which is a screening that you can do for a lot of things like Down syndrome and so on. That's not available here at all. And so many of what is run-of-the-mill or standard practice in other countries, we don't even have available here yet. So the technology is moving along, but we're still where we are now. And I think the other important issue, and this may also be an issue in China, Dong, is the myths and the traditional beliefs in society and the stigma that is associated with patients with rare diseases. So whether they have a diagnosis or not, I can understand, you know, in my context as well, where babies do get abandoned. And in many cases, in many of our communities, they're hidden. The children are hidden, and they're only brought out in the middle of the night for treatment. So there's a lot of factors in this whole topic.
So we need to do a better job of giving these frontline, you know, healthcare professionals the tools so that they can actually recognize that there may be. But I'm going to take a big step back, and I don't know, Dong, if you got this in your research, but we certainly get it. It's the frustration of families and parents who try to tell their doctor that my child actually has something wrong. And yes, you're giving me a diagnosis and you're giving me a horse diagnosis, but it's not working. And, you know, I'm doing all this stuff and it ain't working. And so we need to also train the healthcare professionals and the pediatricians to listen to the families, but we also need to help the families be able to better document what it is they're coming in with.